Namaste, and a very warm good evening to all our viewers today for attending this webinar as part of the International Yoga Day. And this is a special webinar for our new mothers out there who is watching our session today. And as you know, this topic for this webinar is Nurture the Nurturer, Post-Pregnancy Care. And with us, we have a wonderful speaker, Saraswathi Srividya sister. Welcome, sister, to this webinar. So we'll have an introduction about our speaker, Miss Saraswathi Srividya. Saraswathi Srividya is seasoned Hatha Yoga teacher with deep expertise in pre and postnatal yoga, vinyasa flow, and children's yoga. She is skilled in alignment, adjustments, and modifications of asanas to ensure a safe and effective practice for all levels. Her mission is to inspire individuals to set long-term health and fitness goals, enhancing their overall well-being through yoga. Her yoga journey began at the young age of 10 in a traditional Gurukul setting, laying a strong foundation in classical practices. She holds a one-year diploma in yoga from the renowned Kaivalyadhamma Institute and a master's degree, MSc in Yogic Science, from the S. Vyasa, Bangalore. She spent 3 years at the Kaivalyadhamma Health Center, working closely with individuals to address various health concerns using therapeutic yoga. We welcome you, sister, on this occasion of the International Yoga Day.
Thank you, sister. I'm very happy to be here with all of you.
Thank you so much. So we have a few questions for you. These are the common questions we get from all those new mothers out there. So are you ready to take up some questions? We'll have a
Yes, yes,
good flow.
sure.
Okay, sister. So the first question is like, what are some of the most common physical and emotional changes a woman goes through post-delivery?
Yes, so we all have been trained how to take care of the baby, but very few, or it's close to no, have been trained how to take care of the mothers and how mothers can take care of themselves. Because pregnancy and delivery is a very profound experience a mother goes through. So, what happens after the delivery? A lot of hormones and everything is trying to come to normal. So, there's digestive issues, there are hair fall, there are fatigues, there are body pains, a lot of things happening in the body because body is trying to come back to the normal routine before how it was before pregnancy. And emotionally it feels like a roller coaster. You are happy because the baby has come, at the same time, you're fearful. How do you take care of the baby? You are overwhelmed. You have anxiety like, how will I manage these things? Because for the new mothers, it's a first experience, like how they go through this experience. So, it can feel like a lot of chaos. But when you take care, when they mothers take care of their health, it can be a very good and beautiful experience. So for all the mothers, it's okay, you are not alone going through all of this. It's okay to go through this, but you should be knowing that how you can take care of your health and well-being during that important phase of your postpartum.
Absolutely, sister. As you told, like it is the mother who is not being taken care of, or who feels that who is not being taken care of when all the pampering goes to the child, right?
Right.
Absolutely right. So, can you share why postnatal care is such a crucial thing for the new mothers?
Yes, so it's not only the child of a birth, it also a birth of a mother. Because a delivery, mothers knows how the labor pain and how they go through those 9 months carrying a baby inside their womb, and then when everything comes out, how bodies start coming to the normal. So in Ayurveda, it is called as Sutika Paricharya. It is from the time of the delivery to the 40 to 45 days period is where the woman has to take care of her health maximum. And that is a very important phase for a postpartum mother. Like she has to be very much taking care of her health and well-being, because at that time baby's health depends on the mother's health. So she has to have a nourishing food, because baby is only drinking breast milk. So if mother is having nourishing food, that nourishing food through the breast milk is directly transferred to the baby. So that's why, and when you take care of those 45 days, body start coming to the normal routine, and so the longer health becomes much better. If like somebody, they do not take care of their health as like after delivery, then in longer run they develop the back pain, bone issues, the different kind of pains. So that's why, because something has come out of your body, so something has to heal inside. Your uterus has expanded, so it has to come to the normal shape, and it's need time for healing. It also needs some tricks and tips how you can heal it faster. So that's why, for a mother, all the mothers out there, it's important that you take care of your health during that 40 to 45 days, because if you take that care seriously, in longer run your health will be much better. And you also, it's not only your health, it impacts your baby's health also. So when you take care of your health, you feel good, then you pass those vibrations, those energy to the baby also. So that's why it's a very crucial period. So and then they do massages when this period, that 40 to 45 days period, they do massages. It is called as abhyanga in Ayurveda. So those massages are very important for your tissues, for your bones, for your muscles to heal, like to get that oiling of the body, and that's why it helps you to heal faster. So some people like avoid, oh no, I don't like massages, but believe me, and it's my personal experience, how it has helped me to heal faster and in a much better way, not going through a like traumatic experience even the part like after the delivery. So that's why whatever have been prescribed in our scriptures has some logic and some base to it. So doing that, taking that postnatal care for 40 to 45 days is crucial and important for all the mothers out there.
Absolutely. So thank you for really emphasizing the real duration, because there are mothers coming up and they who don't know for how long they should actually take care of themselves. Like with the crucial period, you have clearly mentioned it's almost like 40 to 45 days.
45 days.
Absolutely. And in this era where most of the new mothers are working, they'll, try to hurry up their routine and they want to start working. So, as you told, the time which is spent for themselves and nurturing themselves and the baby, how important it is for both. So,
Right.
absolutely, thank you so much for that beautiful answer. And one more thing that these days we can see that, maybe because of this lack of nurture or it's the current era, like there are many people who are coming up with postpartum blues, right? So, can you share some practices that can help the new mothers to relieve the manage the emotional stress or the postpartum blues?
Yes, so when we talk about yogic practices, so after the delivery, we cannot practice asanas because your body is trying to get it to the normal routine and the normal shape. But breathing is one of the powerful tool I believe, and I always say to people that you can practice anytime, anywhere. And your breath is such a powerful that it instantly relax your mind. So when you do proper breathing, it improve oxygenation, it improve blood circulation towards each and every organ of the body, and it also flush out a lot of toxins from the body. This says if you do right breathing, you can flush out around 60 to 70% of your body toxins. And the post delivery, what happens, it's like it's also very hectic for the mother. We do not have like sit and do 1 hour of yoga or meditation. It's like you have to find 5 minutes, 10 minutes in between whenever you get time. So breathing is something that can be easily adapted in that routine. So when you start, because postpartum blues are, people think, oh, it's in the mind, but it's very much real that people go through that postpartum anxiety, the postpartum depression, a lot of, wild thoughts coming in the mind. So and breath is something, a very beautiful shloka given in Hat Pradipika. Chale vate chale chittam nishchale nishchalam bhavet. Your mind is directly connected to your breath. When you bring control over your breath, you can bring control over your mind. So when a lot of thoughts going on in your mind, and sometimes it becomes so difficult to control those thoughts. So what can you do? Just start observing your breath. Your breath is your power, and when you start observing your breath, you will feel much lighter because there is proper oxygenation in your body, and you will see your mind is also relaxed, because when you start focusing on the breath, you will not be focusing on the thoughts. So that's why I think breathing is something that the mothers should adapt in their routine immediately after the delivery. That's something very important. They can definitely do it without, it does not have any harm. Just do right breathing. Sit for 5 minutes with yourself, just 5 minutes a day. And I think that can be, that's not very hard that we cannot find 5 minutes. We can find 5 minutes, just sit 5 minutes with mindful breathing where you are completely focused on your breath. Because your breath has the power to bring control over your thoughts, over your mind.
Absolutely. Yeah. So, how important it's not only about the breathing practices, but how to focus on the breathing that will help to control the thoughts, the depressive thoughts, the psychotic thoughts that comes up during the time of the postpartum. So, sister, just can you share some practices which can help the new mothers for their recovery?
Yes, so at that time we can only do simple breathing practices, and I say mindful breathing. Mindful breathing means you are fully present in that present moment. So you are completely observing only your breath. So people say we all are breathing, but mindful breathing is something which can definitely break that chain of wild thoughts, the chain of leading thoughts to, and different. And as a new mother, it happens, it literally happens, and we think why this is happening to us. But it's okay, accept it. The first thing is accept it without any judgment. It's okay, it is happening, and you have the solution for it. And the solution is your breath. So one practice, that is abdominal breathing, that can be done. So what you have to do, just placing your right palm on the abdomen, and when you inhale, just bulge your abdomen out like the balloon. As you exhale, sink your abdomen in. As you inhale, bulge your abdomen out. As you exhale, sink your abdomen in. Inhale, bulge your abdomen out. Exhale, sink your abdomen in. Inhale. Exhale. Inhale. Exhale. So around 10 to 15 rounds of abdominal breath are enough. So this breathing practices, because what happens when you do abdominal breathing, it also that your diaphragm moves down and it massages all your abdominal organs, because during the pregnancy your uterus has expanded. The abdominal organs was also a little squeezy, not getting proper place. Now all the abdominal organs also trying to settle at their place. So abdominal breathing helps to massage all your entire digestive and abdominal organs. So this is a very powerful practice. Just placing your hand will help you how your abdomen is bulging out, sinking in. So your attention will not go away on any of the thoughts when you place your hand, because you're completely involved in that moment of breathing. The second breathing you can be doing is chest breathing. That's also very powerful breathing. So placing again right hand on the chest, again When you inhale, just expand your chest, open up. Exhale, relax. Inhale, expand your chest, fill your lungs completely. Exhale, relax. Inhale, exhale, inhale, exhale. As you inhale, you are inhaling all the positive energy. As you exhale all the wild and negative thoughts. As you inhale, you are inhaling all the positive energy. As you exhale, flushing out all the negative thoughts and energies. Just relax. So this is also very powerful practice just to relax your mind, because at that time your body needs relaxation, but more than the body, your mind needs more relaxation, because mind can go, in imagination which we cannot even think. It can go wild, so controlling the mind is difficult. If I say do not think about monkey, the only things come in the mind is monkey. So that's why, how do you bring control over your mind? You can bring control over your mind just by the breathing. So these two are the very simple practices. 15 rounds of abdominal breathing and 15 rounds of chest breathing can be practiced. And there's one more powerful practice of Brahmari Pranayam, and which has been my personal experience. It not only helped me, but it also helped me with making my daughter sleep faster. If I do this practice, so she will be like, it will help babies also to go to sleep and feel a little kind of comfort. And I literally tried it with myself and with my daughter. So you just have to sit comfortably in any cross-leg position. If you cannot sit cross-leg, you can sit on the chair, on the bed, anywhere. So what you have to do, just inhale through the nose. And while exhaling, you have to make sound like a humming bee. Inhale. Inhale. So 5 to 10 rounds of this practice is enough. And this practice, especially if you feel the difficulty in sleeping, as a new mom, you don't have, like, we don't have schedule. We just have to go with the flow. When the baby wakes up, we wakes up. Midnight feedings, diaper change, everything come. So anytime you feel you are not able to sleep, just do 10 to 15 rounds of Brahmari Pranayam, and believe me, it will make you fall asleep, and it also improves the quality of the sleep, because new mothers, the most thing they struggle is with sleep, that they do not have good sleep. And good sleep is very important because it also helps you recover faster. So that's why doing Brahmari Pranayam before sleeping, anytime in the night you're not getting sleep, just start doing Brahmari, and you will be amazed how it helps you to get good sleep, improve the quality of the sleep, and also helping your baby also to settle down. Because when you do Brahmari Pranayam, it create that vibrations and generate some kind of release some hormones in our body, which is kind of happy hormones, which relaxes your system, which reduce anxiety. And there's a lot of research has been done on Brahmari. If you read, you just go and Google Scholar or PubMed, you'll see how it has been very helpful for anxiety, depression, and stress. So just do abdominal breathing, chest breathing, and Brahmari Pranayam. Just add these in 10 to 15 minutes of these practices in your routine, and you will see how it can make you feel much, much better in your journey of motherhood, because it's a very beautiful journey and we have to make it memorable. So just adapt these practices and you will be very good. You'll feel good.
Beautiful, really beautiful, sister. Like, as you are demonstrating, as I'm trying to experience that, that itself is so soothing. Just one thing, like, when can this mothers do this practice? Because it's a breathing practice. Is there any time where we have to
Yes.
see? Yeah.
Yes, so what happens? Any practices you cannot do after you had your meal. So anytime when you had already your meal, like maybe 2 hours after your meal, you can have it. You can do it, or before meal when you have not had your meal. So if you had the heavy meal, so just wait for 2 hours and then you do it. Or if you means up supposed to have your meal, just do it before half an hour of your meal. So because when your stomach is full, you cannot do, because all the circulation of the body goes to digestion. All the blood circulation is rushing towards the digestive system. So at that time, your body need more energy to digest the food. You don't want to slow down your system. So either do it like 30 to 40 minutes before your meal or 2 hours after your meal, or 30 minutes before the fruits and after the fruits is okay.
Okay. At the same
Yes.
time, going with the flow of the baby also matters, right?
Yes, that's I always say to the mothers, you don't have to be in the routine, just go with the flow. You don't have to set up routine, oh, 7 o'clock wake up, oh, I have to do this time. No, just for some time, just observe that flow. And if you go with the flow, you will be feeling much lighter. You will not be resisting yourself, oh, this is my this time. There is no time at that time, your time. It's your time with the baby, and you have to adjust, because for the baby, it's also new for them. They have not learned this. They also trying to adapt to this routine, adapting to the nature, to the families, to everyone. So for them also it takes time. So for us, see how much difficulty as a mother we feel. So imagine how much difficulty the tiny baby who has no idea what is happening around him or her. So that's why just going with the flow, how the baby is just making you to go. That's very important.
Great, sister. I'm sure this must be a lot relieving to all the new mothers who are listening to this. So thank you for that. And as you told, there are so many thoughts that comes up, right? All thoughts of all kinds of wild thoughts that can enter a mother's mind. So what are some gentle affirmations or guided thoughts you would recommend for the mothers during this postnatal
Yes.
period? Yeah.
Yes. So one thing is we we reflect, whatever the thoughts coming in mind, it's not it also kind of create that energy around us. Whatever we think, we become the same, and it's very much true. So if we start thinking a lot of negative thoughts, you start feeling that negativity all over the place, around people, everywhere. You see, why nobody's understanding me, right? Because that's inside us, we feel that nobody's understanding us. So one thing is, or all the mothers, I would say, because body has changed drastically. So one thing is, embrace your body at that time. How beautiful it is that your body has the capacity to create another human being. So just be proud of your body, be proud of yourself, that you have created a human being. When we do not think about it, but think about it, how beautiful it is. So one thing is, my body is doing amazing. My body holds the capacity to go through all the changes and challenges coming my way. I embrace this journey. I embrace my body. I embrace my mind. And I embrace everything I have. Because whatever you think, you will reflect and you will resonate that energy to others also. Sometime we might not be aligning in the family, whatever. Sometimes the grandmothers have different thought process than the new mothers. They say do something else. We say no, it does not work this way. But at that time, you do not have to go into the argument and fighting with them. Just say, my body is doing best. I think this is the way it should be. Let it go. It's okay. Accept it. Because the moment you accept it, then there's no resistance. But the more you resist, the more it comes your way. The more it will be bothering you. And at that time, The more important thing for you is your health, your baby's health. Instead of going into the argument, so always say, I'm doing my best, because one of the thing is for the moms is the mom guilt. Am I being a good mother? Am I doing enough for my baby? Or am I doing everything I supposed to do for my baby? So that mom guilt is, and even I had that, it's not something very like you only have, it's all the mothers, it's same for everyone. So just say you are doing your best, you're feeding your baby, you are with your baby, and that's more than enough. So that's just be the one thing is embracing yourself in that journey. Just sit with eyes closed, say, my body can do amazing things. I accept it as it is without any judgment. My body has the capacity and the energy to go through all this process. And am I doing? I am doing best for my baby, and I'm the best mother. So just repeat these affirmations and you will feel much, much better. It's not only you have to repeat one day, every single day, just repeat the same. So, and that will help you, bring your energies back, and then same energies you just transfer to the baby, because baby is breastfeeding. The breast milk is not only the milk of the body is coming, all your thoughts, energies, everything comes. So when we talk about the ancient times, who cooks the meal? So what intention you keep when you cook the meal? So here you are cooking that meal, that milk, you're making that milk for the baby, so your thoughts and everything coming into you. So especially when you're breastfeeding, at that time, just sit and just repeat those affirmations and talk to your baby. And one of the very good thing, just talk some good and positive affirmations to the baby. You are healthy, you are happy, you're peaceful, we both are enjoying this journey together. So it creates more bonding between the mother and the baby.
Amazing, sister. It's really beautiful. I would really urge our viewers who are our new mothers who are watching this webinar right now. After the webinar, please go through the affirmations again, write it down, keep doing it. Hearing itself, embracing our own self, that word itself feels so good, so soothing to listen. So thank you so much for that, sister, for this beautiful affirmation. And what we understood is it's not only the affirmation to the mother, but we are giving positive affirmations to the baby as well. Both of them grow very well. So beautiful about that. And so another question that we have is how soon after delivery can a mother begin yoga, as you are sharing few yogic tips, and what precautions should be kept in mind for that?
Yes, so it depends on every individuals. So yoga, when we talk about yoga, yoga is not only asanas. So here we will be specifically talking when a mother can start practicing asanas. The breathing and meditation you can start practicing as early like as you can, whenever you feel comfortable, from the second day, third day, whenever it is possible. I started even from the next day, started doing simple breathing, just sitting with myself. So, and when we come about the yogic practices, it depends. Suppose somebody who has been practicing yoga, who are yoga teachers already, so they can practice even after 1 month or 1.5 months. But generally, for vaginal delivery, it is you should be waiting at least 6 to 8 weeks, and after that, you can also check with your gynecologist, and then you can start practicing. And for the C-section, it can take up to 3 to 3.5 months. For body takes a little more time to heal. You have stitches. So, and that also you can start even before, like you should be checking with the doctor, and then you can start practicing. So, and the precautions is take it easy. Do not take it light. Means do not take it very hard, like, oh, I have to just now perfect. I'm on the yoga journey. I have to do all the asanas now. Just start very slow with simple joint movements, then simple practices, easy practices, and then as your body start feeling more confident, and when you feel, yeah, now I'm ready, I think I can do more practices, then adapt the more and more practices. So you do not have to suddenly jump on a 1 hour sequence. Start with maybe 15 minutes of practice, then 20 minutes, then half an hour, and then gradually gradually progress in your practice. So that practice, if you suddenly do, what happens, you will might be doing it for a week, but after that your body gets so fatigued because your body is still healing. You're not completely healed and become like, yes, no. So that's why just start slowly and take it easy, and then you will feel that your body started also healing, and you are also adapting these practices in your routine, which are helping you in healing faster.
Great, got it, sister. It's a good tip for all the new mothers out there. So, another question is, what are some tips that you can suggest to balance rest, movement, and self-care during this postnatal phase?
Okay, so I think spoke about this, how you have to adjust to the routine.
Mhm.
So it's it's a very good, it's a very famous saying, sleep when the baby sleep. But what has happened, what I have observed in today's generation of mothers, our generation even, I'm the same generation, as we are too much into this social media, or maybe our work, so workaholic, I have to get back to the work. So what happens, we are, when we baby sleeps, we feel, oh, we have got the time, just do some work, do something, right? And that leads to sleeplessness, more fatigue, more anxiety, because you are not resting enough. And then we say, night I'm not getting proper sleep because baby is waking up, but the daytime baby is sleeping. As a small baby, they sleep 16 to 18 hours. So that's the one thing you have to follow, is sleep when the baby sleep. Do not sit with your work, with your, and it's not like the baby is not going to be 1 month for all life. No, they are growing up. So after that, when they also become, after 6 months, you don't have to like very much feeding them. They also start doing something. So that those the crucial period you have to make use of, because that is the time for you healing. So that's why managing rest, like I always say, there's a very beautiful example. Suppose you have one cup and cup is empty. You cannot give anything from the empty cup. You have to fill that cup. So this body is like an empty cup now, as of now. So the more you take rest, you fill your cup. When you have a cup filled in, you can only give to your baby. But when we do not have energy by ourselves, what how do we take care of our babies? And it's the only mother, mother is the only, or the grandmother might be, but the mother knows what baby wants. We all know it, like how a baby wants, what time, what baby wants. So the mother can understand baby much much better than anybody else. So that's why for a mother it's important to be present with your baby, and also prioritizing rest. So first few months, just sleep when the baby sleep, take enough rest. Do not jump into work. Work is not going anywhere. It will be there. If you are in your 30, if you're 35, work still be there. You still have a chance. But the baby will grow. Baby will not be 1 month. They will be 5, 6 years at that time, and they, after that, they will have their own set of friends. They will not be wanting you all the time. So just enjoy that phase and prioritize at that time your sleep, your rest, and just taking care of your health and your baby's health is only thing important. Nothing else is more important than this. And believe me, I'm saying it from experience. I used to be so anxious. Oh, I have to start work, I have to start my classes, I have to do this. But after some time, I realized, see, my work is not going anywhere. If my baby is 5, I still can go back to the work and just pick it up even within few years. But the baby, by the time she'll grow up, she will not be wanting me all the time. But now this is the time she wants me, and I have to be present with her. And I also have to take care of my health, because when we are healthy, we can create that healthy environment for the family, for the baby. So
Absolutely.
your health is equally important as a baby's health. So prioritize rest and prioritize sleep, prioritize your baby's health. Work will not go anywhere. Believe me, I'm saying it from the experience to all of you.
That's really, really connecting, sister, especially when you share from your own experience. I'm sure that it's a very good tip for all of the new mothers who are listening to this. So just it was a very beautiful journey going through all the answers that you're giving. So just one final question to you, sister. Like, if you could give one message to every new mother listening today, what would it be?
So a lot of, worry what I can give to my baby, what I have to build for my baby, I have to get this for my baby. We all have, that ambitions. I want this, I want that. One message: your body does not need anything. Your baby just needs you. Be present for your child in however old your child is. It's for all the mothers. If you have child 3 years, 2 years, 4 years, however, your child does not need things from you. Your child needs you. So just be present for your child whenever, wherever your child needs you. That's the one message, and I sincerely urge all the mothers, just be present with your child. And I really emphasize on this because at this point of time, we are in this hustle and not getting enough time. We get them expensive toys, we get them expensive thing, the branded clothes, everything, but not the time. Your baby does not need what expensive, how much expensive it is, and they don't need also. So, the one thing the baby needs, the mother and the parent should be present with the child. So, just one thing: be present with your child whenever they need you.
Thank you so, so much. That wonderful message that you're giving to all the new mothers out there. I'm pretty sure that all those who are going through a lot of stress and how to manage their emotions will be finding this webinar so relieving. And I really hope and pray that all of you who are listening to this webinar take up these practices. They are very simple, very gentle practices, which not only help you, but also your baby and the whole family. So, thank you so much, sister, for this beautiful message. And thank you, everyone, for joining us today and listening to this webinar. Thank you.
Thank you.